Good afternoon, everybody. My name is Kate Clark, and I serve as the project director for the Ready Communities Funding Collaborative, and I work with grant makers in aging. And I'm joining you all here today from Philadelphia, where I've worked in the field of aging locally for roughly 15 years, and I'm incredibly excited to join the statewide pilot grant program. Um, so today we have over 200 people joining us, and we are incredibly excited to share this with you. And we really are thinking about managing the session effectively and making sure we can answer as many questions as possible. So our chat function is actually disabled, and instead there's going to be a dedicated Q&A feature, which you'll see on your screen, where you can submit questions throughout the presentation. And today's session is being recorded, and we are going to post it on the Ready Communities website and share it with attendees by the end of the week. And slide. Okay, during today's session, you're going to learn about grant makers in aging and the Pennsylvania Department of Aging and our roles in this project. We'll provide an overview of the Ready Communities Initiative and talk about how it connects to Aging Our Way PA, which is Pennsylvania's 10-year multi-sector plan for aging. We'll walk through the key details of the pilot grant program, and then we hope to save about 30 minutes for the Q&As from the chat function. Okay, and so now I'm happy to hand it over to Lindsay Goldman, the CEO of Grant Makers in Aging.
Hi, everyone. Thank you so much for joining us today. Next slide.
Lindsay, I'm taking over. Hold on one second.
Okay. Minor technical transition. But you will soon see the next slide, which will tell you that I am Lindsay Goldman, I am 47 years old, and I am the CEO of Grant Makers in Aging, the only national membership association of funders mobilizing money and ideas to strengthen policies, programs, and resources for all of us as we age. Through opportunities to connect, collaborate, and co-fund, which is the role we're playing here today, we assist funders in incorporating aging as an established, an emerging, or an intersecting investment. Aging is such an underfunded priority. We at GIA work to help funders pool resources and to build and sustain partnerships between philanthropy and government. We are honored to provide fiscal administration services to the Ready Communities Funding Collaborative that will braid public and private dollars to create a more inclusive and more livable Pennsylvania. Our role includes serving as the collaborative's central point of contact, developing the RFP and reviewing responses in partnership with our Pennsylvania Department for the Aging colleagues, recruiting and coordinating philanthropic partners, streamlining the fiscal management and disbursement of all funds, and overseeing the data collection and reporting. In playing this role, we are hoping to simplify your lives and maximize your funding and your impact. And I want to thank Kate and Emily, both based in Pennsylvania, who have been leading this effort for Grant Makers in Aging. And now I'd like to introduce Jessie Pierce, Executive Director of the Pennsylvania Council on Aging at the Pennsylvania Department for the Aging. Over to you, Jessie.
Thanks, Lindsay, and thank you very much for the overview. GIA has been an incredible partner in this work. Grant Makers in Aging, I shouldn't use acronyms, sorry about that. As Lindsay said, I am the Executive Director of the PA Council on Aging. I am also the point of contact and project lead at the Department of Aging for this project, for the Ready Communities Funding Collaborative project. It has been a pleasure to work on bringing this project to life. So I'm going to ask that we go to the next slide, and I'll talk you through a little bit of the role of the department and the spirit and vision for the grant. So Ready Communities stands for Resilient Environments for Aging and Dementia in Your Communities. So the focus is on aging and dementia. we are essentially acting as a nationwide pilot for a new streamlined model with the goal of eliminating some of the lumps and bumps in the road that sometimes prevent efficient philanthropic partnership with public entities like state government. So what that means really is it's kind of hard, it turns out, to match public funds with private funds. And we are trying to solve that problem here in Pennsylvania. And one thing that's very exciting about that is that we are doing that with the goal of increasing funding for community-driven projects that support older adults, people with dementia, caregivers, family members, and neighbors of all ages. So, we are going to test the structure and strength of our funding collaborative model this year through the 2026 pilot grant cycle. So this is our first grant cycle. We hope to do more in future years, but we're using this to test how well it works. In its first year, this current grant cycle that you are all gathered here for, the Department of Aging is contributing $325,000 in seed funding statewide. And then the request for proposals is one single statewide request for proposals for nonprofits, local governments, and project coalitions to apply for funding at levels of $10,000, $25,000, or $50K. Then the Department of Aging will work with our partners at Grantmakers in Aging to make our selections, select the projects that we want to fund. And then Grantmakers in Aging will work with our network of, at press time, 35 participating funders, although that number may have gone up as we're getting a lot of interest from our participating funders across the state, also known as the Funding Collaborative. We'll circulate those for potential match. So we can go to the next slide, please. I want to talk a little bit about the overarching goal and spirit of the projects and the projects that we hope to fund with this money. So the Ready Communities 2026 grants will be awarded based on alignment with at least one priority from Aging Our Way PA, which I know that many of you, if not all of you on this call, are likely familiar with. Aging Our Way PA is the Commonwealth's 10-year multi-sector strategic plan for aging. And what's key to understand about multi-sector plans and about this plan and about the projects that we want to see is we want to see things that are crossing a number of institutional pathways. Working with both public and public organizations, working with nonprofits, generating diverse partnerships, different branches of local government working together, that kind of thing. We want to see, I know we use the word de-siloing a lot, but essentially just kind of blowing the doors off of what we can imagine is possible. So I'm not going to get into the gritty details of the project examples here, but you should be able to see them all. I am going to touch on each of the priorities. And I also want to emphasize that the project examples are not designed to be prescriptive. They're designed to generate creative ideas. So if you are looking at them and thinking, mine is not that, will I still be funded? The answer is probably, it's probably eligible. And these are just to give you an example. So don't go based on these in terms of prescription. So unlocking access is our first priority in the Aging Our Way plan. And it kind of represents opening the door for participation, making sure that services and opportunities are available to everyone, regardless of background. Aging in Community focuses on creating safe, accessible, affordable, vibrant neighborhoods that are able to meet our needs as they change, as we age. Gateways to Independence focuses on transportation of all kinds. So cars, yes, but also public transit and active transportation and sidewalks and bike paths and anything you can think of in ways to get around. Caregiver supports uplifts our caregivers, both paid and unpaid. And education and navigation ties everything together to make sure that people can access information and resources in ways that are easy to find and from sources that they trust. So those are the 5 priorities. And I think I am turning it over to Kate now for the next section.
Great. So for the next 10 minutes or so, I'm going to go over the grant logistics, and then we will open it up for questions. Okay, so slide. So this slide outlines the overall timeline for the Ready Communities program. The RFP was released on May 4th, and then applications are due on June 12th before midnight. And then from June through August, applications will be reviewed jointly by the Department of Aging and Grantmakers in Aging using the review criteria in the RFP. And I'm going to touch on that later. And so at this time, we are going to select the projects that will receive 50%, at least 50%, in funding from the state. And then during September and October, participating funders, those 35 so far that Jesse just mentioned, they will receive and review the selected applications that specifically align with their geographic priorities and their missions for potential co-investment. So for example, applications coming from Erie would go to, say, the Erie Community Foundation and not HealthSpark, which funds only in Montgomery County. Yep. So, yeah, and then final award announcements are expected in December, and then funded projects will be implemented during 2027 for the calendar year. And then grant payments are expected to be distributed in 2 installments, January and July 2027. Slide. Okay, eligible primary applicants include Pennsylvania-based nonprofits, including colleges and universities. We got a question about that. County and municipal governments, coalitions with a fiscal sponsor. And to clarify what that means, coalitions or collaborative initiatives without nonprofit status may apply through a fiscal sponsor that's an organization, a 501c3, or it could be a foundation. So yeah. And then for-profits cannot be lead applicants, but they can be partners on a project. And then finally, an organization may serve as the lead applicant on only one application, but you can be on as many applications as a partner that you want to be on. Okay, slide. So to help organize the initiative statewide, we're using the Pennsylvania Department of Community and Economic Development's 6 regional divisions. And the website for this map is located on the RFP website. So you can hover over each region and see the different counties within it and where you are. And so applicants are going to need to identify the region or the regions where the project will take place and where the communities are that are being served, specifically for the application. And so this is critical for matching applications with funders that are geographically focused. And many of our funders are geographically focused. So yeah, and another question was that organizations do not need to be physically located in the community where the project occurs, just as long as the proposal clearly demonstrates meaningful local partnerships and community connections. And then lastly, we are using this map also to ensure equitable distribution of funding throughout Pennsylvania. We really want to fund strong projects represented across urban, suburban, rural communities statewide. Okay, next slide. Okay. So Jesse did showed some examples of different types of projects that we could potentially fund. This slide further explains it in that the intention of the pilot program is to fund new and innovative programs, the expansion of existing programs to serve new populations, and or the enhancement of existing programs in new ways. So just all to say that we're not going to be funding the ongoing delivery of existing programs as they're currently delivered. The funding is intended for 1 year. And as Jesse mentioned, while the focus of the grant is on older adults in general, or specifically on people living with dementia, or both, many strong projects will also create broader community benefit. And then lastly, projects can be small neighborhood-based initiatives or larger county-wide or regional or statewide efforts. It's really flexible. Okay, next slide. Yeah, and then this slide just highlights what we will not be funding, like what we just said, things that are existing currently. We are not funding large capital purchases such as buildings or any type of vehicles. We had a lot of questions about that, or major equipment. Because this is a community-focused initiative, yes, universities can apply, but not to do research, clinical research, or project development outside of the scope of the grant. We cannot support fundraising and other activities unrelated to the goals of the RFP. And then, yes, please do check out the RFP for a whole list of things we will not fund. And then the next slide. Okay, so the model. You've heard a bit about the model already, but just to tell you about it again, it's a first of its kind funding model in Pennsylvania. And to our knowledge, one of the few examples of a public philanthropic partnership nationally. One of the key features of the model is simplicity for applicants. So organizations submit one short application for the $10, $25, or $50,000, like rather than applying separately to multiple funders like the state and different foundations and so forth. It's like totally streamlined. We do not have a predetermined number of grants that we'll be awarding at each funding level because awards really depend on the quantity and the strength of the applications received. And also, this is a pilot project. This is our first year. We're going to see how this all rolls out. Applicants should therefore request the amount of funding that best aligns with the scope and cost of their project. Like there really isn't a strategy in selecting the amount, the funding number. Applicants. So then what's going to happen is that the applications will be jointly reviewed by PDA, the Department of Aging, and GIA. And then the certain applications will be selected for the 50% in funding from the public dollars. And then GIA, Grantmakers and Aging, this team here will work with the participating funders who have agreed to review applications to consider co-investment. Like there's no financial commitment with these organizations. They're just agreeing to review them. And so right now we have, as Jesse mentioned, 35 philanthropic organizations. And because they haven't committed funding yet, like to specific projects, we're not going to publicly share who all these funders are at this stage in the process. But like additional information will be shared, I'm sure, like, as commitments are finalized and projects are starting to get funded. And then what's interesting here is that a single application can be reviewed by multiple philanthropic organizations. And a question was that folks wanting to know whether or not applicants need to independently secure matching funds, and you do not. We are going to do all that legwork. Philanthropic co-investment, as you all probably read in the RFP, is not guaranteed. So applicants should be able to build realistic and very flexible budgets. So like if a project receives partial funding, applicants will have the opportunity to then adjust the project scope, budget, or timeline. And I'm just going to give an example. It's the same one in the RFP, but maybe some folks didn't get a chance to read that yet. So slide. So an organization applies for $10,000 through the grant program, and PDA and GIA select the project, and we commit 50% or $5,000. And then GIA shares it with a foundation who says, okay, I want to contribute $4,000. So collectively, the project is $9,000. And so then the organization who got the funding would then submit a revised budget for $9,000. And then GIA disperses the award. Ideally, it would be $10,000, but we got to see what happens when, in those summer months when we're connecting with the funders, or fall months, excuse me. Okay, slide. So what we're looking for, the largest category here is strategic alignment. The reviewers will look at how clearly the project aligns with the goals of Aging Our Way, PA, which Jesse discussed, and you all have a link to it. Applicants should describe who will benefit, how communities will be engaged, and how success will be measured. So strong metrics and meaningful outcomes are super key. Reviewers want to see a realistic and thoughtful plan with a clear budget. And of course, as we talked about, the ability to adapt if partial funding is received. And then while the collaboration and partnership category is just 15% of the score, we have to say it's incredibly important because strong community connections are often what make projects successful and sustainable. And so we're going to look for projects grounded in meaningful relationships with local organizations, older adults, and existing age-friendly or dementia-friendly efforts where appropriate. Next slide. So for those who are selected, GIA will serve as the primary administrative partner throughout the whole period, as Lindsay had mentioned. Awardees will enter into a grant agreement with us, with GIA, and all grant funds, including the public and the philanthropic dollars, will be distributed through GIA. So we're streamlining that process. And then applicants will need to track public and philanthropic funding separately, and that's for reporting and compliance purposes. One key benefit of the model is that there's a unified reporting system to GIA rather than separate reporting requirements like to the state and foundations and so forth. And then grantees can, of course, expect ongoing communication throughout the whole process. And then the next slide. Great. Okay, our applicant FAQ, which is currently on the website, it's going to be updated regularly as new questions come in. You can email us questions at any time. And if they haven't been addressed in the RFP or in the FAQ, we will add them. And we will also be adding a bunch of the questions that come up today onto the FAQ as well. So that was a lot of information, but this will all be on the website for you to review at another point in time. And I think we're going to switch over to the Q&A. I will say one thing is that we have received many questions asking whether specific projects or ideas would be eligible for funding. And so due to the anticipated volume of applications and inquiries, we're actually not going to be able to meet individually with applicants or provide one-on-one feedback on project concepts. So if you can then reframe your question, if you have a question like similar to that in a way that's broadly applicable to other applicants as well, we are very open to answering those, but just not specific questions regarding your own specific project. And so I did try to include a lot of the questions that we've been emailed into the presentation I just gave. But there are a few additional questions that were not included in the slides. So I will address a couple of those. And then Jesse also has some slides that they received. So is it permissible to combine Ready Community funds with Pennsylvania Neighborhood Assistance Program, NAP, contributions from corporate partners? The answer is yes. We've talked about university and colleges, yes. Can multiple departments within the same city government apply separately? So under the current structure of the program, different departments within the same city government, they can apply separately as long as they're proposing distinct projects. And we would say we would encourage coordination and collaboration across agencies where possible, but no, it doesn't have to be like that. Okay, Jesse, I'm going to send it over to you for the questions that you have received.
Okay, great. So we received a couple of additional questions that I'll address really quickly as well. Okay, question 1. Since the Department of Aging is the partner on this grant, should our projects focus on tactics from Aging Our Way where the department is the owner, quote unquote, as opposed to ones that might fall under Department of Health, Department of Human Services, Department of Community and Economic Development, etc.? Really good question. And this person even calls out the Appendix B in Aging Our Way PA, which is a great resource if you're looking for a list of the tactics. The Appendix B is the best place to find them. The answer to this question is no. You should not necessarily focus specifically on ones that the Department of Aging owns or is leading, unless that's what you want. The intention is to provide funding across multiple different disciplines, multiple different sectors. So don't let it stop you. If the Department of Aging is not listed as a lead or a partner on the tactic, go for it anyway. Okay, so that's question one. Question two, for stronger scoring, does the program generally prefer one highly visible demonstration corridor or several smaller connected improvements throughout the community? I think this is a hard question to answer because it depends. I can certainly think of scenarios in which a demonstration project would be greatly resonant, but I can also think of examples where several discrete and unique community impacts would work well. I think it's all about the way that you spin the narrative. So I think the answer really is it depends. Question three, are project administration, coordination, reporting, and community and engagement costs eligible expenses under the Ready Communities program? The answer is yes. All of these, I think, would fall under the administrative overhead or indirect costs category of your budget. The budget template has a section for this already, and the indirect or administrative overhead is not to exceed 10%. Question four, are costs such as volunteer training, local coordination, implementation support, background checks, resource, toolkit development, evaluation, are these allowable if they are part of launching a new or enhanced community volunteer pilot? Absolutely. As long as something does not violate the eligibility guidelines for eligible activities, it is perfectly acceptable. Yeah. And I think that's all of the questions we received ahead of time. Is that right, Kate?
Yeah, yeah. And then we have a list of questions. I think, Jesse, you have access to that list as well. I can read them out and then anybody on our team can jump in, or I can as well. The first one is, in terms of funding priorities, are dementia specific projects or broader older adult projects preferred? Neither, no, they are both, I think they're both equally important. Jesse, did you want to say anything else?
I think this is the way that I would answer this question is that applicants are encouraged to identify ways that their projects will benefit all of our target communities. So the more that you can demonstrate benefit to older adults and people with dementia, and kind of lean into additional categories of social vulnerability and things like that, like really knowing your audience is going to improve the chances of receiving funding.
If your proposal is not selected in the first round by PDA, will you be notified immediately or do you have to wait until December? Jesse, thoughts?
Wait until we'll make our announcements in December. That's when everyone will be notified. Yeah.
Okay. Would a placemaking initiative with the primary goal of building a publicly accessible recreational structure? Okay, wait, sorry, that's getting into a very specific question. Okay. You mentioned one of the examples that that work about working with Erie Community Foundation. Are we precluded from requesting funding from a community foundation for the same project? No, no, no. Go ahead and do your projects. Are most of your funders already focused on aging? What if they are foundations that are already funding our organization? Actually, that's an interesting question. Many of the foundations that we're working with are not solely focused on aging, and aging is a part of their work, or it could be just like a piece of like one of their larger focus areas. And this opportunity is like very exciting for them to be able to expand their portfolio on aging. So, and then if they're already funding your organization, it's totally fine. I mean, they will look at who the applicant is and decide whether or not they want to fund the project even more so. Do selected funders give 50% match to the state, or must the applicants need to raise the 50%? Applicants do not need to raise the 50%. GIA will be working with the funders, and the funder contributions are actually going to come to grant makers and aging, and then we are going to disperse the state and philanthropic funds to the applicants. So we're streamlining. We're like a one-stop shop. What if your project would be located in more than one region on the map? That's totally fine. You're able to indicate that on our application. And you'd probably have more access to different funders who are geographically based. Do we need to have a sustainability plan? Yes, in our application, we do ask for your plans for sustainability. We're definitely wondering about where you plan to go with the project. Will there be an evaluation component of the grant program in this pilot phase? Yes, grant makers and aging and the PDA team, we're all going to work together to develop a an evaluation to understand what worked, what didn't, and how we want to move forward the following year. When funding disbursements are made, will they each be mixed, both public and private, or one disbursement is public and one is private? Lindsay, did you want to take that one?
Oh, sorry. Sure. They will both be mixed. And so you will be asked to outline a budget and expenditures, noting what you've spent the different pots of money on, but you will receive one check, and there will just be one report. So we will streamline it, we will braid it, but the PDA money does need to be tracked a little bit separately. So that will look like a column in your budget on an Excel spreadsheet. Jesse, anything to add there?
Nope, that's correct.
What is the submission platform like? Is there a form we need to complete separately? It's an online submission. If you go to the website, you can check it out. It's super easy and very simple, streamlined. Yeah, there's no paper, like you don't have to submit anything in any other way. Jesse, is there a minimum number of seniors that applicants should be committed to reach?
Not necessarily. Again, I think this is a question that's proportional to the service size of both the organization and the geographic region, because that's going to be very context dependent, depending on whether you're like in Center City, Philadelphia versus in, Forest County. We also want to have a diversity of projects that take place at a variety of different level, like sizes and scopes. So no is the short answer.
How strong should recommendation letters be? We're not actually asking for recommendation letters, so you can take that step off your list. If a proposed project fits within more than one priority area of aging our way, I think you can just use your judgment and decide which one you feel like it fits in the most. But you do have to pick one area.
I will also say we are weighting all 5 priorities equally. So we're not prioritizing any one category over the others.
Jesse, are we looking for bigger one-off projects, or would a series of smaller but consistent programming events across the county be eligible?
Again, I think this is a similar situation to the previously answered question. I think this really comes down to the strength of your narrative, and how you sort of sell or package the impact of the project. Either a large-scale demonstration project or a series of smaller programs could be beneficial and could receive funding.
Somebody asked about the budget template. It's actually on the website in the application. How many applications did we get last year? This is actually the first time we're ever doing it. Yeah. Can the grant be used to pay for staff time?
Staff time is an eligible expense. Yes, you can use it to pay for staff time, as long as it's related to the project. I saw that we also had a question about capital improvements. This grant is not intended for the purchase or renovation of buildings, the purchase of vehicles or equipment. That said, if there is a component of like accessibility renovation to the wider project, and if that project will benefit an expanded population beyond the current population served, or if it will create a new program that draws in new service and new beneficiaries, that will be considered.
I see that someone's asking about what mechanism or platform will be used to track metrics outcomes as a unified reporting. I can't give you a whole lot of details on that, but what I can say is that the grant report that we ask you to complete will be the same as the metrics that we are tracking. So there is not a separate evaluation. There's no independent evaluator. You will fill out one narrative and one budget form, and we will use that and think, carefully about what questions we ask you to get all of the information that we need from you one time. There was a question about whether an organization had to be based in Pennsylvania.
I think this is a question for me, if that's okay.
I think so.
So organizations who are not headquartered in Pennsylvania, if you're a nonprofit, for example, who's not headquartered in Pennsylvania, you are eligible to apply. But I will say it will strengthen your application to have site-specific partners listed to demonstrate that you have a robust presence in the community. I also saw that we have a question about pre-award expenses and what the timeline looks like on that. Let's see, what does it say? When you use the term pre-award, do you mean when we find out if we will get funded, or do you mean January or July 2027? Can we spend all the money on the project in 2027? Or like in January, does that count as an expense? So basically just asking about what the timeline for pre-award expense means. Anything prior to disbursement of the funds would be considered pre-award funding. So anything before January 2027, when you have the check in hand, if you receive the award, would be the answer.
There's a question about the 6 geographic areas and whether or not we have funders in each one of those areas. And yes, we do. We are trying to get equal numbers of funders within each of the different regions, but we definitely have a good amount in each one. And then another one asking whether or not all of the funders fund projects within those 5 areas from the plan. And I would say like almost all of the funders would consider all the different areas of the plan. There might be a couple that are specifically focused on one area, but in general, yes, all of the different areas in Aging Our Way.
Which has been great for us to meet new funders that traditionally have not seen themselves as aging focused funders, but because of the multi-sector nature of the plan, that's given us an entree to some of the funders who are focused on other funding priority areas. With which we know that aging always intersects.
Mm-hmm.
Someone's asking if the word limitations are strictly enforced. And I will say, yes, they are. We expect a lot of proposals, and we are trying to make the proposal application experience as quick and painless as possible. And for that reason, we really do need you to get right to the point. Is there an ability to submit supporting documentation? That question I don't actually know. Kate
No.
or Emily Barron?
No, there isn't. We just have an area for nonprofits to submit their 990.
But there is also a question on there about your community
Yes.
misspeaking. About your community partners where you
Yes.
can list them. That is what we're going to use to get the best sense of your partnership coalition.
And you can link to things, right? In the body of the text.
Think so?
I think so.
We had a question about non-clinical research. So is a non-clinical research component permissible for funding? For example, could a portion of funds be used for a qualitative or an economic analysis? The answer is yes, I think. Kate?
Yeah.
You're saying yes on this, right? As long as it's public facing and it's evaluating the project rather than being the focus of the grant being for an evaluation itself, it would qualify. So it needs to be attached to a community facing project. Are interfaith projects considered? Yes. Certainly welcome faith-based organizations. As long as you have an employee ID number attached to your application, and your employee ID number is not for a for-profit organization, you can apply.
Somebody asked about the 5 different priority areas. You can, there's a link to Aging Our Way, the plan that really goes into detail with the 5 areas. It's on the website for you to click on. You could also Google Aging Our Way PA.
Oh, we can't drop links in the chat for people here,
I don't
can
think
we?
so. Is the online platform able to be saved and returned to later? The answer is yes.
All right, there's this question. Can you please explain one more time the joint review and commitment process? Do we want to do that real quick, Kate? You can do it or I can do it. I don't mind.
Go ahead.
Okay, so the funding process is applicants are not required to find any matching funding. However, if you want to state for us, there is a section of the application where you can say additional sources of funding that you already have to strengthen your application. That's fine. And that gives us information that's helpful for us to know when we go on to the next step. So once you submit your application, the Department of Aging and Grant Makers in Aging will work together to make our selections for public funding. And that is guaranteed to be at least 50% for selected projects. So for example, when we're choosing one that is an application that applied for $50,000, let's say, if the Department of Aging chooses to fund it, it will receive at least $25,000. Then After that commitment is made, grant makers and aging will work with the philanthropic funders who will, and this is important, consider matching. They are not required to match our projects to participate in order to be considered participating funders. So we're circulating these for their consideration, and we're going to work as hard as we can to get the other 50% covered by philanthropic organizations. That may come from one philanthropic organization. It may come from a number of different ones. They may say, let's say someone is like, well, we can put down 10K for this project, but we can't cover the whole 25. So then we go and we find someone else and we say, can you do the last 15K? And then maybe we make it there, maybe we don't. If we don't, let's say we max out at 35K. Then we would go back to you as the applicant and say, can you send us a revised budget for $35,000? And if that gets approved, then you'll receive that much funding.
But whether you're funded by 3 funders or 5 funders, you are only submitting one report.
One application, one report, and one set of checks.
Do projects need to be affiliated with dementia-friendly or age-friendly certification? There were 2 questions asking that, and the answer is no, they do not need to be affiliated. It would be great though if your organization were to, or your area, your county or your city were part of the age-friendly or dementia-friendly movement, to connect with those folks and see if you can partner with them, or they can be a part of it, or at least know about your work. And I know that some areas are going to use the funding to apply to become designated dementia-friendly or age-friendly areas, and that is perfectly fine to do. And in fact, it's exciting. So.
Another specific question that we have about the age-friendly and dementia-friendly: what if our project is not affiliated, but our agency is? How should we answer this question? I think that you should answer it, yes, we are affiliated. Because what we're really trying to get at is whether there is an established coalition of community leaders working on age-friendly and dementia-friendly projects in your area. And we kind of view it as like, if it's there, we expect that it will be, that those coalitions will likely be involved in some way. So.
Jesse, you mentioned something about an appendix in Aging Our Way. Somebody wanted to know what you were referring to.
Sure. So Appendix B in Aging Our Way, which is also available on the Department of Aging website, contains a list of all of the policy tactics. So there's 163 policy tactics in Aging Our Way, PA. We are not, I should also be clear, we're not asking you to identify a tactic. If you want to, that's awesome. Please feel free to do that, but we're only asking that you narrow it down to the priority categories, so just the top 5. But if you want to dig into the details of the tactics, the 163 policy tactics in Aging Our Way, Appendix B is your easiest way to reference them, because it'll tell you the language of the tactic and what priority it falls under and which agencies are leading or partnering on that work at the state level. So it's just like a bird's eye view of each one. We're getting a couple more. I see a couple more that Emily has highlighted here. What will happen if multiple funders want to support the same project? Well, that would be a great problem to have. And I think if we run into that issue, likely what we will do is work with the funders to see if we can create a funding coalition around the project to allow them all to contribute. If it is a particularly resonant project that we think could be expanded in scope by additional funders, maybe we'll talk to the applicant about that. That's something that I think we may just have to take on a case-by-case basis. We are planning to apply as a nonprofit. We are also considering collaborating with another nonprofit on a different separate project. Is this permissible? As long as you only are the lead applicant on one project, that's fine. So if you were each to act as the lead and then partner on each other's project, if that makes sense, that's fine.
An application asks for EIN or identification number for primary applicants who are applying. Okay. If it's an age-friendly, dementia-friendly community group, or so if it's a coalition that doesn't have a nonprofit, yes, you should identify what's called a fiscal sponsor, or as you're calling it, a lead organization. Yes. So you would identify that organization, get their permission and so forth, and then ask them to be your fiscal sponsor. So then you would use their information for that, for your application.
A couple of people are asking, what if our budget falls between two of the funding levels? Jesse, what do we think about that? I would say, yes, you do need to select one and either do a little more or do a little less.
Yeah, I think that's my answer as well. If you are looking for 15,000, I would say either figure out how to shoestring it a little bit for 10 or think of something that you could spend an extra $10,000 on. And then it may end up coming out in the wash anyway, depending on how much funding you get. So.
Did we do the one about can a 2026 project be submitted even though the grant awards will be dispersed in 2027?
We did not.
Okay, that's helpful. Thank you, because I no longer have a short-term memory. Okay, so what do we think about this one? So does the project have to be totally new starting in 2027, or can the project have started?
The project can have already started, but pre-award expenses will not be eligible. So you can use it for the project term in 2027.
And do all the funds have to be spent by a specific date?
We are going to have a no-cost extension process. So you can apply for an extension if you need to.
It is not known at this time if funding will be available again next year, but we very much hope that it will be.
Again, the strength of the applications that we receive and the impact that they can make, and also funder engagement, and the impact of their funding is really going to carry this project into future years. So because this is a pilot, we are hoping to be able to take what we learn and take the impact we make this year and spin it into a narrative that generates additional funding so that we can offer larger pools of money so we can fund more projects.
What if the project's total cost is well above the level of funding? So someone says, as an example, the total cost is 170,000. I'm asking for 25. Does that fit?
As long as you are upfront about that in
Yeah.
your application and also list your additional sources of funding, or where you anticipate those coming from if you receive the fund and match, I think we will consider that for sure.
There's an interesting question about fiscal sponsors. Is there a cap on the fees a fiscal sponsor can charge? Can fiscal sponsors support more than one project at a time? And then also, can they be based outside of Pennsylvania?
Okay, I'll answer those one at a time. Fiscal sponsor question 1, cap on fees for a fiscal sponsor. I would say this is in alignment with the indirect overhead costs, not more than 10%. And that'll also need to take into account any grant admin expenses on the part of the actual project executor, if that's not the fiscal sponsor. Can fiscal sponsors support more than one project at a time? Yes. But well, can they? Yes, because it's the you can the lead applicant can only submit one application, but a fiscal sponsor is essentially just lending their employee ID number and administrative services, not actually acting as the project lead applicant. So actually, this is a question I don't know the answer to. How about if we follow up with this person specifically? And we'll list the answer afterward. Is that okay?
The FAQ. Yeah.
Okay.
Yeah, everything will be listed on the FAQ, and if there are any, I think there are some that we actually have not gotten to, but we have 1 minute left.
Mhm.
We'll totally put them on the FAQ. We're going to work on that and have that up hopefully by the end of this week. And we will have the PowerPoint and the presentation on our website.
Okay, well, I think that is our time because we want to respect your time. And so we really appreciate you joining us today. We look forward to reading your proposals. I want to thank Kate Clark and Jesse Pierce and all of our colleagues at the Pennsylvania Department for the Aging, led by Jason Kavulich. And thanks so much for being with us. Have a great day.